is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
So hello and welcome to In Conversation with the Lancet Public Health Podcast. I'm Pierre Nolo, and today I have the pleasure of being joined by Thaisa Villa, the editor-in-chief of the Lancet Regional Health Americas, to help me interview Dr. Daniela Cavalcanti, a postdoctoral researcher at the Federal University of Bahia in Brazil, and Professor Davide Racela, ICREA research professor at IS Global, Barcelona Institute for Global Health in Spain. We will discuss with them the articles we just published in the Lancet Public Health, investigating the health effect of the Brazilian conditional care transfer program achieved over the last 20 years, and exploring the potential future effects depending on different scenarios. In this podcast, I will discuss with Davide in English, and for the Portuguese version, I invite you to check the second version of the episode hosted by Thaisa with Daniela and Davide. Thank you for being us today, first of all. To start with, Professor Racela, can you please describe briefly what is the Brazilian program?
Thank you very much for the opportunity to be here. So the Bolsa Família program is one of the oldest and most consolidated and probably one of the largest conditional cash transfer programs worldwide. It was launched in 2003 and has expanded during the last 2 decades, more than 2 decades, reaching more than 50 million Brazilians. Is a cash transfer. It means transfer funds, money, to poor and extremely poor families, but at the same time as conditionalities. What does it mean? That they receive money only if their children are vaccinated. For example, the growth control is done at the primary healthcare levels. There are prenatal and postnatal visits. These only from the point of view of health, but also we have conditionalities in education. So both the children and adolescent needs to attend school in a regular way. And if this conditionality is in health and in school, in education are not attended, they will drop out from the program.
Okay, thank you. And conditional care transfer in general have been proven to be beneficial to health outcomes in most scenarios where they were introduced or tested. So what would you say is unique about the Brazilian program?
It's the dimension, the consolidation, is surely I will say, especially in health, the most evaluated in the world. There are no other conditional cash transfers that's been so much evaluated as the Bolsa Família, especially in to what concern the health outcomes. Of course, conditional cash transfers are usually designed to reduce poverty and to break the intergenerational cycle of poverty. But what we have discovered since we started to study this 15 years ago is that the effect was extremely strong also in several health outcomes.
Maybe if we talk about this study specifically, can you tell us what you decided to look out in this in the article we just published?
See, in this study that has been led by Daniela Cavalcanti, she's the first author, we decided to look more in general. We have done so many studies during the last decade, evaluating child mortality, maternal mortality, tuberculosis, HIV, and others specific health outcomes. This time we wanted to do the overall. We want to understand, 20 years has passed. We want to understand what was the real impact, not just for specific disease, but overall, in overall mortality. And not only mortality, I think one of the most important parts and the results of this study are the hospitalization. This strong result that during the last 20 years, Bolsa Família has been able to prevent more than 8.2 million hospitalizations. This is huge. And also, of course, more than 712,000 deaths, all age and all cause deaths. So it was very important to make this big picture, big evaluation for the last 20 years, and after, on the basis of that, do our forecasting.
I think you already mentioned a little bit, but do you want to elaborate a little bit on what were the strongest associations you observed, or what were the strongest effects?
Yeah, for example, where there are high adequacy and hospitalization, you can have up to 32% reduction in mortality and 27% reduction in hospitalization. We have seen a greater impact in more vulnerable areas. So an idea of reduction of inequalities and a strong dose response effect. The higher the benefit, the higher the coverage, the strongest the effect, both in mortality and in hospitalizations.
Yeah, and you mentioned also that the idea of the paper was also to look at, like, to forecast. So you simulated different scenarios. Maybe you can tell us what were the different scenarios you look at?
So there was a scenario of expansion. So expanding not the coverage, but the threshold. What we want to understand actually is how to reshape or improve the program. So one of the idea was to change the eligibility rules, to try to make it a little bit more generous and more comprehensive, because today is still important, but still several people that are just above the threshold, eligibility threshold, are still considered poor, and at least are still, even if they are not officially considered poor, actually, they are essentially poor in many of the Brazilian areas, especially when the cost of living is higher. So the idea was to simulate an increase in the eligibility threshold and try to see if this could bring some advantages. So we have seen this expansion expansion option scenario in comparison with a potential austerity scenario could give a difference, but is still very high actually. Could reach almost 8 million of hospitalization still, and almost 700,000 mortality. Little bit more, the 8 millions and 700,000 mortalities.
You mentioned the effects for each scenario, and we can see which scenario is most desirable, but maybe to expand a little bit, like, practically, what do you think will be the future of the program? Like, what do you think is the most likely scenario to be implemented?
The huge discussion nowadays is the financial sustainability. So of course we would like to increase the eligibility, increase the coverage, and the adequacy also the benefits. But the problem is fiscal problem, fiscal sustainability of a program. So we don't expect that the what we call the optimistic scenario of expansion will be feasible in the short term. However, and actually the risk is that the other scenario, the negative one of reduction, actually could be actually more probable if we have 50%. It seems now that globally we have a 50% chance of global recession. Public debts are particularly high. We never know. The changing government can bring some changes, negative changes in the Bolsa Familia program. It's the sense of reduction of coverage, reduction of adequacy, etc. So we don't know a priori which is we will be the scenarios, but our role as scientists is not to predict the future. We don't know the future. You don't know what is going to happen. We just want to show how, according to the policy you develop and the policy choice you have, this will have consequences. One of the problems that we often have is that politicians and policymakers, they take some decisions, but they don't really know what will be the impact of that. And so our role is, as scientists, is to show them that any decision has consequences. And unfortunately, as we were showing now here, the consequences are strong, actually. It's both in hospitalization and mortality.
Given the current difficult landscape for global health funding and the politicization of a social benefit program, what else do you think could be done by scientists to convince policymakers of the importance of such tools and to sustain its continuation?
I don't think that we were discussing also with Danielle and Elliot the evolution and the possible the next challenges as a research group is to try to do some sort of cost effectivity analysis, because what we are showing here is that Bolsa Familia actually has been able to reduce to prevent 80 million hospitalization and can do it in the future. So if you think in terms just hospitalization in terms of costs, avoided costs for the system is huge. But if you also consider prevention of mortality, so loss of productivity or human capital, I'm just discussing the health consequences. But if you consider the education, etc., there are some studies also evaluating this. I think we could say with a certain degree of certainty that Bolsa Familia is not a cost, is an investment. This should be clear for policymakers. These poverty relief projects and programs, not only in Brazil but worldwide, are not costs, are not something a burden for the for the political and for the fiscal system, are actually an investment. And sometimes the investment is not just in the long term. So we say, yeah, invest in education, in 20 years we will have some results. No. If you invest now in Bolsa Familia, the reduction hospitalization can be tomorrow, can be in 1 month, can be in two years. It's something that will give you a return also in the short term.
So thank you very much, Professor Rossia, for joining us today. And you can read this paper on thelancet.com. Thank you for listening to this episode of In Conversation With. I want to remind you that you can subscribe to be notified of new episodes on the platform where you usually get your podcasts.